Okay, picture this, the controlled chaos of a trauma bay. Decisions are getting made in split seconds, and literally every single action could be the difference between life and death. In a world this high stakes, a nurse's expertise is everything. But how does a trauma nurse, a really dedicated one, truly prove that elite level of skill? How do you signal that to your patients, your colleagues, and your hospital?
Right? It's such a critical question. And in a field where confidence and competence are absolutely everything, there really needs to be a clear, definitive answer. Well, for nurses who are truly committed to the highest standards of trauma care, there is one.
So, let's dive into it. The answer we're talking about is the Trauma Certified Registered Nurse Certification, or as you'll hear it, the TCRN. Now, this isn't just another bunch of letters to put after your name. It is the nationally recognized gold standard for excellence in trauma nursing. It's truly the mark of an expert.
So what exactly is the TCRN when you get down to it? Well, it's a national board certification. It's specifically designed for RNs who work anywhere along that whole spectrum of trauma care. Its whole purpose is to validate that you have specialized knowledge and skills. And it's awarded only by the Board of Certification for Emergency Nursing, or bcen. They are the single source for this credential.
Now, this next point is absolutely crucial, so I really want to focus on it. A TCRN is a certification, not a certificate, and that difference is huge. A certificate just shows you finished a course, it's about attendance. A certification, on the other hand, proves your competency. It's awarded by an independent third party after you pass a really tough, scientifically sound exam. It's recognized across the country, you can take it with you from job to job, and you have to renew it to make sure you're staying on top of your game.
All right, so you might be thinking, okay, I'm interested. How do I actually earn this mark of distinction? Let's break down the path to becoming a TCRN. And while it's definitely a journey, the steps are super clear and totally achievable.
The whole journey really boils down to these 4 key stages you see here. It all starts with making sure you're eligible. From there, it's all about focused prep and studying. Then you get into the logistics of applying and scheduling your exam. And finally, the big day. You pass that exam and earn your credential.
So let's start at the beginning, eligibility. The number one thing, the foundational requirement, is a current unrestricted RN license. Now, while bcen doesn't make you prove a certain number of clinical hours, they strongly recommend you have professional experience in trauma nursing. It just makes sense, right? It gets you prepared. And of course, you've got to be in full compliance with all nursing laws.
All right, so what about the exam itself? Let's look at the anatomy of it. You're going to have 3 hours to answer 175 multiple-choice questions. But, and this is important, only 150 of those actually count towards your score. The other 25 are pretest questions that bcen uses to build future exams. The tricky part? You have no way of knowing which is which. So you've got to give every single question your absolute best shot. Okay, this slide right here is your study guide. This is where you need to focus your time and energy. The exam covers the whole spectrum of trauma nursing, but just look at where the weight is. Those high-priority domains, head, neck, and face injuries, and trunk injuries, that's a huge chunk of the test right there. Then you add in extremity and wound care, and you're looking at more than half the exam in just those 3 clinical areas. Mastering these is absolutely critical.
Okay, we've covered the what and the how. Now let's talk about the why. Why go through this process? What's the real-world value of becoming a TCRN? Because the impact, it's felt by you, by your team, and of course, most importantly, by your patients.
This is some really powerful data from a huge bcen study. They asked nurse supervisors to rate their nurses, and the results, well, they're crystal clear. Certified emergency nurses were rated significantly higher than their non-certified peers. And not just in 1 or 2 things, but across every single area of nursing expertise. We're talking technical skill, accuracy, ethics, the whole 9 yards. Leaders see a real, tangible difference.
And it's not just about how one person performs. Just look at this number. An incredible 95% of emergency department nurse supervisors agree that specialty certification is valuable to the nursing profession as a whole. That's a massive buy-in. It shows you the level of respect these credentials have within the healthcare system.
This quote from Ron Krause, a clinical nurse specialist, just perfectly captures the spirit of what we're talking about. It's about a total shift in mindset. He says it's the difference between a job and a profession. And that's what he sees. The certified nurses are more engaged, they're more invested, and they become the leaders who lift up the entire department.
But here's the thing. Earning your TCRN isn't the end of the road. It's not like you cross a finish line and you're done. It's really the beginning of a formal commitment to staying right at the front of your specialty. It's all about lifelong learning and continuing to grow as a professional.
So, how do you maintain that expert status? Well, the TCRN certification is valid for 4 years. To recertify, you'll need to complete 100 contact hours of continuing education, and it has to be directly relevant to trauma nursing. This whole process is designed to ensure that a TCRN is always up to date on the latest evidence-based practices, so they can keep upholding the highest standards of care for their patients. So after seeing the path, the process, and the incredible value it holds, the only question left is the one you see right here. Earning the TCRN is a testament to your dedication, your skill, and your commitment to giving the absolute best care to people in their most desperate moments. It is so much more than a credential. It's a beacon of your professional excellence. So, are you ready?